The 26th July 2005 deluge in Maharashtra left hundreds shocked, shattered and stranded. Flooding began with one of the highest amount of rainfall ever recorded and continued the next day, affecting nearly all districts in Maharashtra, leaving most cities and villages virtually cut off from the rest of the country as telecommunications broke down, airports closed, public transport grounded to a halt, and power cut off. The worst affected areas were the slums. What added to the trauma of the rains was the complete collapse of the entire machinery in these areas. Mumbai was the worst hit.
पिछले साल 26 जुलाई में कचरा होने की वजह से पूरा पानी हमारा बस्ती में आ गया, पूरा फुल एकदम इतना भर गया था उस टाइम पर, और वहाँ से हमारे घरों तक पानी आया, यहाँ गर्दन तक के आप यकीन करिए हमारे घर के अंदर इतना गर्दन तक पानी था पूरा, और पूरा घर का जो सामान था वो सब डूब गया था, बहुत सारा सामान हमारा बह गया कचरे में, हमारा अनाज ये वो सब खराब हो गया उसके अंदर.
Are we better prepared now? Yes, we are. Since the tragedy, active measures have been taken to be better prepared for such situations in the coming years, using micro-planning. Micro-planning is a 5-day process which mobilizes the communities to analyze the issues faced and act upon them. Using micro-planning, Unicef, along with the BMC, has covered close to 464 out of 550 slum pockets, each with a population of 6,000 to 8,000, with the help of 12 NGO partners. Volunteers from the communities come forward and devise methods to improve and enhance the living conditions in their areas. These community volunteers are then trained by experienced staff from Unicef, AMRI, etc. to help them effectively use their skills for their communities. The first day is used to analyze the situation of the area demographically and socially. The next day is spent on data collection through detailed forms, following which we spend the next 3 days generating awareness about children's health with emphasis on vaccinations, basic hygiene, health and nutrition. The last day is spent on drawing up action plans and allocating jobs to various community members who take ownership of various tasks that will help the community counter issues. In addition to micro-planning, 3-day disaster preparedness training is being organized to train around 4,000 volunteers in life-saving techniques during emergencies in Mumbai. Around 100 schools in vulnerable pockets are being imparted disaster preparedness training as well. This process is facilitated through intricate partnerships between the municipal functionaries and NGOs.
मैंने ज्योति सबरी महिला मंडल से वॉलंटियर की ट्रेनिंग ली थी. जब हमें ट्रेनिंग के लिए बुलाया गया था तब हमें ये पता नहीं था कि ये क्या चल रहा है, ऐसे ही बुलाया है, क्या मतलब क्या था यही पता नहीं था. लेकिन जब हमने खुद ने ट्रेनिंग ली तभी हमें पता चला और हमारी आंखें खुली कि हमें कम्युनिटी में कैसे रहना है. क्योंकि हमारे कम्युनिटी में पहले कैसा होता था कि स्वच्छता नहीं थी, कोई भी अपने यहाँ के वजन नहीं करता था. लसीकरण के सिर्फ पोलियो के टाइम भी सब लसीकरण करते थे. लेकिन जब हमने ट्रेनिंग ली तो हमने सबको बताया कि कैसे कैसे रहना है अपने कम्युनिटी में. और जब पिछली साल 26 जुलाई को बाढ़ आई थी तो हम सिर्फ यहाँ वहाँ भागते रहे थे. अपना खुद का बचाव कैसे करें और अपनी कम्युनिटी का बचाव कैसे करें ये हमें पता नहीं था. लेकिन जब ट्रेनिंग लेने के बाद हमें सिखाएगा कि अपने कम्युनिटी में कैसे रहना है और खुद के साथ अपने भाई बहनों का बचाव कैसे करना है ये हमें पता चला. और इसका एक फ़ायदा हमारे डेली रूटीन में ये भी हुआ कि हम पहले हमारे यहाँ पे कोई एजुकेट नहीं था, मतलब सब जो जाते थे वो 5वीं 7वीं 8वीं तक ही पढ़ाई करते थे. लेकिन अब हमने उनको संदेश दिया है कि अब आगे भी पढ़ाई कीजिए, क्योंकि पढ़ाई करने से ही आपकी नॉलेज बढ़ेगी और आपको आगे भी उसका फ़ायदा होगा.
We at UNICEF looked at this disaster preparedness planning project as a golden opportunity to really get into the slums, organize communities around issues related to children, and develop action plans with the community as the key actor. Microplanning, which was tested out in the rural settings, we thought could best be piloted under this situation. We see youth as extremely critical if we need to intervene in the intergenerational problems that are of early marriages, early pregnancies, leading to poor health, poor nutrition, both of the mother and the child. Creating awareness, mobilizing them, creating community norms on some of these fundamental issues were central to our process. What we were looking for is to create a strong cadre of youth that would be constantly working for the benefit, welfare and development of their own communities. So as part of the micro-planning process, we requested communities to nominate one boy and a girl for every 1,000 population, who were then trained through a 5-day development training process where they defined the role in terms of what they would be doing when they go back into the communities. What we hope to achieve through this process is to organize the youth at the slum level, get them to start monitoring key indicators of children, for which we have produced a monitoring register for every slum pocket. We also created a strong alliance of about 12 NGOs and 4 professional institutions to come together, plan the whole project and implement it at the community level. This partnership of communities, NGOs, government functionaries represented through the municipal corporation have already started making an impact on the slums, where you see cleanliness activities being taken up every day, better coordination with the Anganwadi center, the health post and the ward office, and a new initiative at the slum level to have a better and more meaningful life.
जब हम कम्युनिटी में गए तब सबसे पहले तो वहाँ के लोगों ने हमें सहभाग दिया ही नहीं, लेकिन जब हमने उन्हें अपने काम के बारे में बताया कि हम माइक्रो प्लानिंग कर रहे हैं जिसमें कि हम पानी, स्वच्छता, आरोग्य, लसीकरण के बारे में लोगों को जानकारी देते हैं, तो वहाँ से हमें लोगों का थोड़ा बहुत सहभाग मिला। लेकिन वहाँ ज़्यादा से ज़्यादा सहभाग हमें युवा पीढ़ी का मिला, क्योंकि हमने उन्हें अपने कामों के बारे में पूरी जानकारी दी। हमारे काम के द्वारा समाज में कौन कौन से सुधार हो सकते हैं, लोगों के जीवन की जो परिस्थिति है वो कैसे सुधर सकती है, जब उन्हें यह पता चला तो उन्होंने हमारा सहभाग दिया। और जब हम फिर से वहाँ पर कम्युनिटी में गए, वहाँ पर एक्शन प्लान लेने के लिए लोगों की परिस्थिति जो है उस समस्या का हल निकालने के लिए, तो सभी लोग वहाँ पर जमा हुए और मिलकर उन्होंने अपनी अपनी जिम्मेदारी ली और हमारी जो समस्या थी, जो हमारा कर्तव्य था, उसे पूरा किया।
Along with the communities, the BMC officials are also getting an up training in disaster management from various NGOs. 1,200 ward officials from 8 of the most vulnerable slums are being trained in their role during emergencies.
Now, after the deluge which happened in Mumbai last year, 26 July, lots of organizations, especially NGOs, were trying to see not only how they could mitigate the effects of the disaster, but they were also concerned about how such situations could be handled in the future. So one great area of concern for the Unicef, the BMC, as well as NGOs working with the slum dwellers was how would you prepare the slum dwellers to not only deal with the disasters as they occur, but also the aftermath of such disasters in terms of the diseases and the health problems which arise. So we did a kind of brainstorming with the NGOs and the representatives of the Unicef, and we also experimentally carried out certain operations in some of the slum areas in which we tried to engage our the health workers of the municipal corporation who work in the slums, brought them together with the active NGOs in the area, and the UNICEF representatives conducted a program of training these the NGO volunteers and other volunteers like students, and also training our health workers to work in coordination with the NGOs to be able to get information about the health status of the slum dwellers and to see what kind of interventions can be immediately done. The experience of the UNICEF in making sustainable interventions of this kind in the rural areas, along with the understanding of the problems in the urban slum areas, in Mumbai, which was gained after the floods, led to the development of a program of micro-planning and working together. And what you find happening today in Mumbai is a result of all this.
After learning the lessons from the last 26 July, Mumbai Municipal Corporation was fully prepared for this year's rainy season. With the help of Unicef and other NGOs, we prepared a very elaborate action plan which includes the first time the SOP or the Standard Operative Procedures. The Public Health Department geared up for the immediate surveillance. We have about 900 staff, that is called multi-purpose workers and auxiliary nurse midwife, working in the 168 health posts. We formed the teams of about 450 teams, and immediately they started door-to-door surveillance of fever cases and diarrhea vomiting cases, other monsoon-related cases. Daily about 4.5 to 5 lakh population was covered through this rapid survey. We have taken help of the NGOs for our IC campaigns, for persuading patients to come to our dispensaries, as we have trained our doctors for these monsoon-related diseases. The main focus was on the slums and slums-like areas, where our people have conducted a lot of health talks, especially focusing on the waterborne and foodborne diseases and the precautions to be taken, especially the fever and the diseases like gastroenteritis, etc.
After the crisis, I was in charge for the L ward, where I saw the condition was worst and people immediately needed first aid and relief work. Within 1 or 2 days, we found there was an additional need of medical and other support was required very severely. We identified a local community-based organization, youth, NSS volunteers and people from our own department, the CHVs, the health volunteers who came together, and these volunteers were trained by Unicef at the slum level for micro-planning and disaster management. On behalf of corporation, we supported them to the disaster management department as well as from the solid waste management department. It was a very good coordination effort by the BMC and the Unicef to train volunteers, which will be very helpful in future in case of any disaster. This is a big social asset that corporation has developed with the help of Unicef.
We've been privileged to be involved with Unicef and AMRAI and the BMC in documenting this micro-planning project that has been undertaken over the last year. Actually, this whole process of documentation has been most exciting because we have these young researchers going into the field and actually interviewing those who have participated in the entire process. What has been most inspiring is to see how through the micro-planning process there has been a sense of self-confidence, a sense of self-worth and a feeling of taking command of their own destiny that has come through very powerfully in the community. There is a sense of bonding in the community which has certainly been very, very important. This has been underlined even further for us when we have actually conducted a series of capacity building workshops with the facilitators from the community themselves. We find that these facilitators have a strong sense of motivation. The process seems to have given them a feeling of commitment to the community as a whole, so that they're really wanting to do something as a whole. There is a sense of self-determination, and this is what we feel is the real essence of the micro-planning process.
The involved NGOs, the BMC, UNICEF, we are all in partnership basically to bring our expertise to the community so that the community evolves its own norm for monitoring the development and the growth of the children, as well as regards children as their assets. If you look at the BMC infrastructure is responding at present more effectively towards the need of the children. There is a lot of awareness which is generated in the functionaries of the BMC, like the garbage is removed on the time. The people have been also motivated to put where the garbage. There has been an increase in the immunization level status. Even if you look at the enrollment of the children this year, where the micro planning process has been completed, I mean to say I'm happy to state that it was 100% enrollment, and at the same time NGOs also have enhanced their expertise. Like we were providing welfare services to the children, but now it's basically developing the capacity of the people to come together. It is amazing to see the youth getting involved in this entire process. We have been able to mobilize about 12,000 youth till now. There has been various training program which has been going on for them. The youth are responding in monitoring the development indicators in the community, which is generating an awareness in them, which is leading to certain functionalities. At the same time, the community which was not valuing the youth, who considered them to be the delinquents or people or the boys who really waste their time, have started valuing them as an energy which could really change the process.
With all the productive work being done by the government, NGOs, and most importantly, you, we are definitely better prepared now.